Inside Seton Northwest Hospital, a member of the Seton family of hospitals, a transformation is taking place. One that will allow nurses to spend more time with their patients and less time on administrative tasks. More importantly, it's helping patients feel better sooner, and it's even saving lives.
This process that we've been in through the Transforming Care at the Bedside has been probably one of the most interesting projects that I've been engaged in for probably 30 years that I've been in practice. And I think the exciting part of it is the staff come up with the ideas and they own the project until they complete it. And so that's been very exciting to see the staff take their ideas and really make them work.
It's all part of Transforming Care at the Bedside, or TCAB, a pilot program sponsored by the Robert Wood Johnson Foundation and Institute for Healthcare Improvement. The idea of the initiative grew from the realization that an estimated 35 to 40% of unexpected hospital deaths occur in medical surgical units, in part due to the sheer volume of inpatient care being delivered in these units. TCAB was established to empower frontline staff to effect change, be more patient-centered by involving the patient and family in care decisions, and ultimately improve the overall quality of care provided, while at the same time improve staff satisfaction. Seton Northwest is one of only 13 hospitals in the country to be participating in Phase 2 of the initiative.
What I've seen in both instances is absolutely brings joy to me in terms of what our vision is for this project. We see that there is leadership on the unit level from staff nurses to physical therapists, pharmacists, clinical assistants, unit secretaries. Basically, they have created an environment that everyone that has a role in patient care on their Transforming Care at the Bedside unit have a role in truly transforming care for their patients.
The nurses can't wait to tell each other about what they've come up with that's new and different and been making a difference.
But it's the people that are right there on the front lines that tell you, why don't we try doing it this way? And try it. And it'll be great.
It's about new ideas, and it's about an environment that encourages sharing and innovation. It's that commitment that is allowing the nurses in Seton Northwest Med-Surg unit to improve both the quality of care for their patients and their own working environment.
We did over 50 projects in, I think, the first 3 months. We did so many projects. It was a blast.
One idea that was tried and caught on was to join doctors on their rounds. It has saved time and increased communication.
I think it's made my patient care more efficient and more complete. We're kind of now a team approach here. Usually before seeing a patient, I'll talk to the nurse and we'll go in the room together and talk to the patient. And there are issues that the nurses bring up that are quite valid and that perhaps may have been overlooked. And since she's with them basically the whole shift, she can tell us whatever concerns that we may be missing.
Saving steps seemed small, but added up.
They did one simple thing, which was to move their medication cart.
It was a lot of walking just to get a medication. So we've added a second, actually it's our third because we have one on the other side too, but a third medication cart there for us. So it saves some steps.
It's interesting when you have engineer types that come in and tell you that it's going to save nurses over 1 million steps per year. You sort of stop and think, wow, that was a very small change. What else do we need to do?
Another suggestion turned a back-office scheduling process into a meaningful shared system for managing nurses' workloads.
The status board is just a magnetic board that has all the nurses' names on it that are working for the shift. And every 2 hours, the charge nurse will check with the nurse to see what their status is.
Okay.
And the green means that they can take an admission. Yellow means they could take one, but if they could wait an hour, they're a little bit busy. And red means that they're really busy and they're swamped. So it gives them the autonomy to say when they can take an admission.
The board not only caught on in the Med-Surg unit, but also is being adopted elsewhere in the hospital.
It's a process that we appreciate first and foremost about Seton Northwest, and then secondarily the innovations that the hospital has come up with. And you know, small innovations at that, but all added together to make a real and palpable difference in the work environment of those nurses.
think that the nurses feel that they're with the patient more. They've got less paperwork to do at times. They're making rounds with the physicians. They're finding out what the physician is thinking in order to get the patient discharged. They're going in as working as a team.
Patients and their families are key players in the Transforming Care at the Bedside initiative. Their overall satisfaction and ability to be involved in the care they receive is a very important component.
We have spent time in here. They don't just like run in or run out. They make sure that I have everything I need and make sure that I'm comfortable.
We've been able to pioneer a lot of things, test a lot of the things here at Seton Northwest, and the things that we've learned here and we've demonstrated are very doable. They improve quality, they improve patient satisfaction, they improve physician satisfaction, and of course the retention of the nurse has gone way up. The percentage of time that nurses spend, it's gone up dramatically. It was in the 30% range and it's up into the 60% range right now.
The 60% figure from a patient's perspective is extremely important. Patients are here for nursing care. I think it's not a surprise that they don't come to the hospital for the food or for the housekeeping. They really do need nurses taking care of them.
I think years from now, Mary Viney, Joyce Batchelor, and the myriad of staff nurses at the Seton Northwest Hospital can look back at this experience and know that they have been pioneers in an absolutely transforming project that's going to truly make a difference in every hospital in this country and in medical surgical nursing. I think that all of them do and should feel very proud of their contributions to a nationwide effort that actually now is expanded to be an international project.
Just grab your group of people together and say, what do you want to do to change things? What would you do if you could change things? And write it down and try it.
Transforming Care at the Bedside. The nurses of the Seton Healthcare Network are today shaping the future of healthcare.